Doctors injecting doctors.
Wait, what? Doctors injecting doctors?
That's right.
This is going to be incredible. I cannot wait to see this. Dr. Lauren Willoughby and Dr. Nicole Callan, both of which have been on Talking with Docs many times, and now they're injecting each other, or at least in one direction, right?
Correct, yeah.
Okay.
Yeah, we're going to do some Botox injections. So we can show a little bit about how we plan Botox, where it goes, and then we're going to do a follow-up in a couple of weeks so you can see the results of them. So this is my breastie, Dr. Nicole Callan. And
sorry, did you say you're breastie?
Correct.
Okay, I missed that. We're just going to need an explanation on that. What do you mean by breastie?
Well, we do a lot of our breast reconstruction work together.
Okay.
So we're kind of like besties, but breastie, you know.
Okay.
It's
so
more inclusive.
Brad Weening is my hippie. We do a lot of hips together, right?
Yes,
I'm going to tell him that.
actually.
I don't think he'll like it. All right, breastie, let's see it.
Okay, so all right, so we're going to show sort of how we analyze where the product is going to go, and then we will do the injection. So Nicole, just lay your head back a little bit. So one of the most common areas to inject are the creases at the top of the forehead. So raise your eyebrows for us, Nicole. So you can see, so Nicole's had Botox for a couple of years now, and it's really helped with the creases. They're not as deep as they used to be. Anyway, I'm just noting that because as you raise your eyebrows, they're not nearly as deep as they were a year ago. So in general, you want to inject in the upper 2/3 of the forehead. If you go too low, it increases the risk of the brow getting droopy. So raise again. So while she raises her eyebrows, we're going to pick, we usually do about 15 units for Nicole. A white eyeliner pencil is nice because it doesn't...
it washes off.
Yeah, it doesn't stick,
so
like
nobody knows you've
like
had it done.
Gotcha. Are you nervous right now? Are you scared?
No, not really.
I am a little.
Are you?
But
Oh,
I'll
gonna
feel
love
better
it.
after
I'm more
this.
worried about when I have to do ugly face.
Okay.
We'll do that last. Okay, give me your deepest frown.
That's it.
No. Yeah, just angry face.
Angry face.
Okay.
Yep, so these creases here, so they're from 3 different muscles. There's a procerus in the middle, and there's the corrugator supercilii and the depressor supercilii. So they kind of are all in a group here. So we usually do about 30 units in an average woman. Being an average woman, an above average woman, we'll still do 30. So frown for me. So we're going to focus a little bit here, and we're going to do, I like to do generally in most women about 5 spots. You want to stay about a finger breadth above the orbital bone, because again, if you get too close to that brow, you can get brow ptosis, so brow droopiness.
And what were the 3 muscles again?
Procerus is in the middle. There's corrugator supercilii. That's the one over here that will give you those kind of vertical lines. And there's depressor supercilii, which is kind of in between them.
I think my supercilii is a little hypertrophied.
It may be too late for you, though.
Supercilii, really?
Which one was my angry one? Which muscle
The
is the
procerus
angry
is in
one?
the
Where I
middle.
looked angry all the time.
Yeah, procerus. Okay, now we say do a really cheeky smile or an ugly smile like this, because that brings out your crow's feet. It's also very attractive. So I like to do 2 or 3 spots. So more cheeky. Yeah, there we go. More like this.
And what are you aiming for there? Sort of the
So yeah, exactly. So we're looking at the course of those lines, and we're going to kind of put a couple of doses right in the middle of them.
Oh, in the middle of the line. Okay.
And it looks nice too if you go about 1 centimeter below the edge of the brow. So the muscle we're paralyzing here is orbicularis oculi.
Okay.
It's the one, so the lines always form perpendicular to the direction of the muscle fibers.
Okay.
So that muscle goes around the eye in a circle. So as we age and it contracts this way, the creases form in that direction. Okay. So anyway, if you go about 1 centimeter below the course of the lateral, which is the outside edge of the brow, it looks nice because you'll get a little bit of a brow lift. So that's what they're talking about when they say you can get like a little Botox brow lift.
Okay, cool.
If you do it too much though, then you get the Spock eye.
Fascinating is a word I use for the unexpected.
Okay.
So,
we don't want to look like
Live long and prosper.
And another cheeky smile.
Okay, what Nicole doesn't know is that I'm going to be doing the injections for the first time in my life as an experiment.
Oh, that's so great.
No. Okay.
You probably could.
I don't know.
You probably could.
The needle looks a bit small for me.
Okay, so we'll get the product ready and we'll start injecting.
All right.
Do you have loops?
I don't even use loops, no. But I have a little pluses on my safety glasses, plus 1.5. But I inject a lot of knees. I'll do that another day.
Yeah.
We can make your knees look 20 years younger.
Oh, God.
It's whatever
I'll
girl
pass on
wants. Okay, so I like to do the forehead first because the skin is really thin and you want to go when the needle's sharp. That needle gets dull quickly. It's a 30 gauge needle. It's really,
that
really
is
fine.
small.
So you're going to tilt your head back just so we're working from a stable surface. So cold and wet, Nicole. It's the alcohol swab just to clean the skin. So raise your eyebrows. So over activate that muscle. I'm watching the little increments carefully.
How much per injection there?
1, 2, 3. We're going to do 3 per site.
Okay.
Can I have a gauze, please? 1, 2, 3. Thank you.
Is it hurting at all?
No.
Like a mosquito bite or not?
Sometimes as the needle gets dull with the next injections, you feel it a little bit more.
Okay.
It's not bad.
You seem to be handling it really well.
Yeah, it's fine.
It doesn't hurt that much.
It doesn't hurt.
Because it's a really
That's
such
a
a
small
Tiny
needle.
needle.
So Nicole, reach up with your left hand. Just put some pressure there.
Okay.
Okay, so we got 15 left. So we're going to do 10, 5, and 5. So we'll do, okay. So cold and wet again. So I like to do a bigger dose right here. 1, 2, 3, ouch. So we'll do a good 10 units there.
Well, that's your biggest one,
Then
yeah.
we'll do 5. Yeah, these muscles are bigger, so they
Yeah.
need a little bit more. Now we'll swap for the next syringe. Thank you, doctor.
Oh, my pleasure.
Okay, and we're gonna do, I've got that, Nicole, thank you. We still need to do this guy, we're gonna do 5.
So you can't see it very well. That is a really, really tiny needle. That's why it doesn't hurt much. It's almost like an acupuncture needle.
It's so small.
Super tiny. 2
We
more.
use much bigger injections when we do knees and other body parts. So
It's because the increments are so small. You want to get it very accurate. Last one.
looks like you're going in just like a few millimeters.
Just under the skin, exactly. You want to get it into the muscle. So reach up with your left hand again, Nicole, and just hold some pressure there. Okay, now we're going to use our last 12 units for the crow's feet. So we'll do 3, 3, 3, and 3.
That's 12.
Okay.
4 times 3.
Ugly smile, your favorite. Yeah, 1, 2, 3. So if you have her activate the muscle at the same time,
Mm-hmm.
sorry, Nicole. It bulks the muscle up, so it
Okay.
does a better job of getting it in the right plane.
Okay.
Okay, you can let go there. There and there. And smile. I'm just going to rest my arm on you here, my hand rather.
So you want to zoom right in on
2,
that.
3.
See?
And last one there. 1, 2, 3. Good job. How did that feel?
Good.
A couple of notes too. You don't want to rub the product in. I'm just trying to dab it. So there's about a 3 centimeter radius that the product will act over.
Okay.
So you don't want to rub it because then you distribute the product too far.
Okay.
And that's what increases the risk of getting things like brow ptosis. Let's get another alcohol swab and just
Yeah,
kind of tidy
gotcha.
her up. So the redness-
Browtosis. Can you tell me what that is?
Yeah, so ptosis is a medical term for droopiness.
Right.
So thank you so much. So if a brow droops, we call it brow ptosis. When an eyelid droops, it's eyelid ptosis, and breast ptosis.
Okay.
So, thanks, Nicole. So the frontalis muscle is the name of the muscle that raises the eyebrow. It's the only muscle that does that. And that's
Okay.
the one that we're paralyzing when you're trying to get control of these creases with Botox.
Okay.
If you're too heavy-handed with the Botox, you actually can't raise your eyebrow anymore. So when you're
Okay.
talking, your facial animation might look a bit funny.
Oh, okay.
And that's what you see like in some celebrities who get super high doses of Botox. Their foreheads don't move when they
Okay.
talk, or their eyebrows don't move when they talk. Having a little bit of movement is natural. It just looks good for like
Right.
a normal facial expression.
Yeah.
So you have to be cautious to not get too close because you don't want that brow to drop. It also matters in elderly people when they have extra eyelid skin, so eyelid
Okay.
ptosis, because sometimes if you have a lot of redundant eyelid skin, those people at rest, when they open their eyes, they're actually opening their eyebrows to help pull the eyelid skin out of their visual field.
Okay.
So if you overdo the Botox and the brow drops, it actually can get harder for them to see
Right.
So you have to be cautious of that.
Okay, so you can see there's a lot of knowledge required to do this. Not just anybody can do this. There's a lot of science behind it, a lot of anatomy behind it, and you want someone who's experienced, who's done a lot of them before, and has really studied this well. Keep that in mind if you're considering doing this. Would that be a fair thing to say?
Absolutely.
Yeah.
Yeah, and things with fillers too.
Definitely.
Yeah,
with
yeah. You
something
need
like
to
that.
know someone who knows what they're doing, who has, you know, the emergency equipment available if there is a problem, and knows what to do if there is a problem. So
Yeah. So you feel pretty good if you have a plastic surgeon who has this kind of experience to do it. Wow.
I feel great when I get it done.
Really? Yeah.
we say we look 5 years younger, maybe not 10 years, 5 years younger.
Give or take.
When it
She's
kicks
really 87. You would never ever guess that. And that's how she gets to continue working for so long.
That's right.
Yeah. Well, thank you so much for letting me share in this and letting us video this,
Thank you
guys.
for having me.
Amazing.
Thanks.
Again.
And we'll check in again in a couple of weeks and
Yeah.
see what it looks like.
Yeah, it takes about 2 weeks for the total effect for the product to work, but most patients will start to see a change in about 2 to 3 days. But it does take that full 2 weeks, and I've seen that myself looking in the mirror every day.
Okay.
That by the time that the product takes its full effect.
And how long does it last for, pretty much?
It varies. They say 3 to 6 months. So I'd say on average approximately 4 months.
Okay. And whenever we do a procedure, we always talk about risks of complications.
Yeah.
So you mentioned the ptosis, that's one. A bit
Yeah.
of bleeding, that's another. What other kind of risks are there associated with this?
The most common side effects would be things like bleeding, bruising, discomfort at the injection site. Headaches can happen with Botox injections as well. I suppose anytime you poke the skin, you could get an infection. I've never seen that
Very
happen.
rare, but could happen.
Brow ptosis we mentioned, and the other one too is if the product gets too low towards the eye, the eyelid can droop too. So that's called
Okay.
eyelid ptosis. That's not an attractive one because you actually can't really do much. There's some eye drops that you can take to help activate one of the muscles to help get the eyelid up a bit more, but it still looks really funny until the product wears off.
Okay, so it's reversible once the product wears off.
Exactly. But you walk
Okay.
around like this.
Okay, all
a
right.
while.
Why are you winking at me? I'll probably make a lot of new friends that way, but not the way we recommend it. And the product you get obviously is from a regulated source.
Correct.
These are all regulatory approved, FDA or Health Canada
Yes,
approved
that's
products. It's not
correct.
the kind of thing
Yeah.
you want to buy online or buy on your own.
No,
or
I don't
anything
think
like
in Canada you can't purchase these things online. You have to be a doctor to order them.
that. Okay.
So
That helps us feel better. Except for this one, we just tried one we bought on Amazon, and
Oh,
it wasn't
perfect.
so- it was really cheap. So, but
Excellent.
we'll check in 2 weeks.
We'll see you in 2 weeks.
There you go. Perfect. All right.
All right.
How
Well,
things
thanks
look.
again. Thanks for letting me take part in this and be part of it. Thanks for doing this.
yeah, thanks, Nicole.